Welcome to our 5 on 5. Pleased to be joined again today by Governor Kate Brown. Governor, good to see you. Thanks for being here.
Thank you for having me.
All right, so I know we got a busy couple of weeks ahead. Democrats have some big goals for this brief 6-week session beginning next week, including a carbon emissions cap, PERS, and health care. Even Democratic Senate President Peter Courtney thinks this may be an ambitious agenda. What's the most important thing for you to see?
Well, I want to make sure that the economic prosperity we're seeing in communities around the state is inclusive, that every single community, our rural communities, our communities of color, our low-income communities are seeing thriving jobs and wonderful economic prosperity. So my focus will be on that, number one.
Okay, looming over the session is the uncertain economic forecast that could give the state a shortfall of a couple $100 million due to the federal tax cut. How will you and your party, since you're in control, make up that difference?
Well, we're looking right now, our focus is going to be on policy for this legislative session, talk about how we can create jobs in rural Oregon, how we can tackle the opioid crisis that is impacting communities around the state, and tackling the PERS unfunded actuarial liability. In terms of the budget, I think you're going to see some hot battles over whether we fund additional buildings for University of Oregon, Cascade campus at Bend for Oregon State University, and a recreational facility at Eastern Oregon University.
Okay. A Secretary of State audit released just yesterday says DHS and child welfare have been slow and indecisive in responding to a growing crisis that increases risk to kids. Among the complaints, overwhelming staff caseloads, dysfunctional culture leading to high turnover, and a lack of accountability and transparency. I'm sure you've reviewed this audit. What do you think needs to be done?
Our children deserve better. Every single child must be safe in our foster care system. I've directed the director, Fariborz Parakesh, to focus on making sure that our caseworkers have reduced caseloads, that they have the training that they need, and that they can provide the valuable services that our children in foster care need. The other challenge for our foster care system is more families. We need more families to step up and provide these services, and I've directed them to focus on making sure that we have an adequate number of families that can meet the need that's out there.
Yeah, what will be different this time around? I mean, DHS has had problems recently. The shortage of foster parents isn't something new. What can be done at the state level?
Well, there's a couple of things. Number one, the director's relatively new. He's been on for 5 months. We have a new director of child welfare. She comes from the private sector. She's also been a foster parent. She's also been a director of the office over in Baker City. So she has the hands-on experience. There's a couple of things I fought last legislative session for more funding so we can reduce caseworkers' workloads, so that we can work to retain caseworkers more than 18 months. So I fought for an additional $35 million. That's getting on the ground now. These resources will help.
Okay, we're going to take a quick commercial break. We'll have much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Governor Kate Brown. Governor, another audit I want to ask about from the Secretary of State's office regarding emergency management, the big one, if you will. It's something I know you're familiar with. I know you've looked at I-5 here, the viaduct locally. That's a lot of money that would take to prepare this state for something like the massive earthquake we could get. How in the world are we going to prepare adequately for this?
Well, we're working hard every single day. I have our Chief Resiliency Officer, Mike Harriman, focusing on making sure that our local jurisdictions have the tools that we need, making sure that we're investing at the state level in infrastructure investments so that will support seismic resiliency, and then making sure that every single household is prepared. And that means having 14 days of water and non-perishable food already in a kit that's accessible, and that's a gallon of water per person per day. So it's a lot of prep and a lot of training. We're working on making sure that our communities have the tools to be ready in the event of a Cascadia event. I have to say, we continue to work to be prepared every single day, but you're never prepared enough. And so this is something that we all need to participate in. We've got our local county emergency management planning. We've got our state Office of Emergency Planning. The key is to work together and make sure that we're leveraging every single dollar that we have.
Okay. Our next question comes from a viewer. Edward Kelstrup asked this next question through our KOBI-TV NBC5 Facebook page. With healthcare becoming more unstable and the ACA reliability brought into question by the GOP stated goals, what measures will Oregon take to guarantee healthcare to all?
Well, I'm very pleased about what happened with Ballot Measure 101 last week, and that is Oregonians across the state voted overwhelmingly to sustain funding for the Oregon Health Plan. That's because Oregonians know and want to make sure that their struggling neighbors, the vulnerable children that we have in the state, have access to affordable care. With the work that we've done, 95% of adults now have access to affordable care, and 100% of our children. That's extraordinary. Still more work to be done to ensure everyone has access. We'll keep working on it.
Good to see you. Thank you so much for being here.
Thank
Appreciate
you.
it. All right, stay with us. We'll be right back.